Uh, Welcome to Kitsap County Parent Coalition. Today's meeting is called Something is Not Quite Right, and Dr. Violeta Gomez is presenting. Dr. Gomez, take it away.
Hi, I am Dr. Gomez. As Mary said, I have been a general pediatrician for almost 17 years, and I recently decided to retire from general peds and then focus on what I really love about pediatrics, which is developmental and mental health in children. As part of my I guess preparation for this retirement, I did a training that is called COE training, which is a Center of Excellence for Autism that is provided by the Healthcare Authority in Washington and given by University of Washington and Seattle Children. So what I want to discuss today, which is I've had experience in the past 6 months, I hear a lot about parents that had like a hunch and they were not listened to, they were dismissed, or people asked them to wait. And they didn't know that they could go, I don't know, the state level or even here in Kitsap and get their children screened and get them services. They didn't need a referral. They can just do what they believe is best for their children. Or even if they did the screening and the screening came back negative, but the parents were still having doubts, you can go get screened. And that is perfectly fine. So that's what I want to share with you guys. So let's see. So I want to talk a little bit about what developmental milestones are and why they are important, what developmental monitoring and screening is, and what is your doctor supposed to do at every well-child visit. So you can expect those things. What are the red flags of developmental delays? We'll have a little discussion about it. And then what to do when something is not right, and the resources in Kitsap for developmental screenings and evaluation. Let's see. So developmental milestones are each and every little thing the babies learn to do in order for them to become functional adults, right? So they reach those milestones by playing, and then they learn to speak, to adapt their behavior according to social situations. They learn how to crawl, walk, run, all the stuff. So developmental milestones are divided into 4 major components. One is social, emotional, language communication, cognitive, and movement or physical. Let me just move this thing here because I see myself talking and okay. So the social emotional milestone is basically everything that babies need to learn in order to express how they feel in a way that is effective and that we all understand them, right? It's the way that they learn how to follow directions and follow some rules, how to have positive relationship with others, and how they build self-esteem and confidence. And you can see this development from the time the baby is like 2 months old, right? The baby's crying and not comfortable, you pick them up and you soothe them and the baby just soothes. And then when the babies are looking at you from playing with other kids, showing you whatever they've made, you know, the kids like, look at me every time they jump. That's part of the social emotional milestone. But they wouldn't develop this if they're, for example, like if a baby is unaware that you're there and then they're like 2-4 months old and they don't follow you around, they don't cry for you, they're not going to be able to have those tiny little blocks that they need in order to build more complex milestones in order for them to develop good relationship with people and society around them. The other one is language and communication. With language, with verbalization, right? We can speak and say what we need, what we want, how we feel, and we also get to understand other people, right? But it's not only about the way that you sound, it's also about the way that you look and how you can interpret the cues that people give you around you, right? So if there's a lot of kids that have language speech delay, but they will be able to tell you, even you can play a game like, I don't know, what is the one that you draw things? I don't know. I forgot it. But, and you can communicate to other people like, if I go like this, nobody's saying anything, but just by your gesture, your facial expression, the way your body moves, you can communicate. So it's not only about the way that you speak, it's about also the way that you use your body to communicate whatever you want, need, feelings, emotions, and also the way that you interpret what other people are doing, right? That you know that somebody is upset because they have this face, and you can go and tell them what's going on, what's happening. So it's not about you saying and expressing, it's also about understanding. So again, like when babies are little, they make sounds rather than crying. And the baby's like about 2-4 months old, as a mom, as a dad, as a caregiver, you can tell, oh, this means probably the diaper's wet. This other cry means that the baby's hungry. And they learn to start sounding consonants, mama, mama, baba, da, 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 and then one word, 2 words, 2 words together, 50 words, and also like waving bye-bye, lifting the arms we picked up, blowing kisses, asking people to be quiet. All those things are way that we use language and communication. And then you need to build little blocks in order to have more complex skills in order for you to communicate in a way that is effective, not only by language, but also by facial expression, body movement, and gestures, right? The other one is cognitive milestones. This is how our brain basically absorbs what we are supposed to learn, right? And it helps us build on those little blocks, right? Like thinking, learning, exploring, and solving a problem. Like, for example, a child that knows, oh, that is too high. Let me just move this thing over here so I can go on top and climb it and go grab it. So that's one of the things that you learn. Again, you learn little things by putting things, like it says there, like putting things in the mouth to understand and explore how it feels, to try to understand the world around you. If you don't have the capacity to understand what's around you and learn and remember things, then your cognitive milestones are going to be delayed. And then the children will not be able to play with toys the way they're meant to be played, or have a conversation, or any of those things. Like everything that we learn is like kind of tied up into the cognitive milestone. If you don't have the ability to understand, then everything else is going to be delayed. The other one is the physical milestones. This was the easiest one, I guess, that people point out, because if the baby's not rolling, if the baby's looking floppy, if the baby is not crawling, pull it to stand, or walking, those things we can see right away, right? And physical development is very, very important. And it changes as we grow. And we can see again, like by the gross motors that they do, also by picking things up, by, again, you need to develop those tiny little muscles in your hands and in your feet. Like before you can write, you need to learn to torn paper and to like squeeze things. That way, if you skip one, then you're not going to be writing very well. So those are the milestones that we need to be developing little by little. So now, every time you go to the doctor, they are supposed to do what is called a developmental surveillance questionnaire. It is basically to ask you, how is the baby doing? How is the baby developing? There's a few things like 2 months, 4 months, 6 months that we ask. Do you have any concerns about your baby? Is the baby eating okay? The baby gaining weight? The baby is following you up when you walk? If there's a big noise, does the baby turn around to look? Like what are the things that the babies are doing, right? And surveillance is just that. It's just a little question, a conversation that we have about the baby. And the doctor examines the baby, make sure that the muscles are not stiff or not limp, that the baby is following the doctor's pen or guess or whatever the doctor is trying to do, and make sure that the babies are healthy, and then make sure that there's nothing in the family dynamics that would be high risk for the baby not developing adequately. And those are the things the minimum things that you would expect in every visit, right? Now, there are also screenings that we can do, and they are recommended based on age. We'll talk about it later. And also at any point that parents or caregivers have questions. If you have a question and you say, I think something is not right and I don't know what it is, and just as my child seems off, it doesn't look like other children, your doctor, even if it's not one of those appointments that they are recommended to do the screenings, they have the ability to do a screening, a general screening of the whole behavior that we talked about, communication, problem solving, fine motor, gross motor, and personal social, and determine if by that screening, more deeper evaluations need to be done, right? So for example, the general developmental screening test, the American Academy of Pediatrics, they recommend to be done at 9 months, 18 months, and 30 months. And additional specific screening for autism should be done at 18 and 24 months. But again, they can be done at any point that you have a concern. And the difference between screenings and surveillance is the screening is a tool that has been developed and validated by people that research this to make sure that whatever information you gather is accurate. The screening is just a little question that we're going to talk about. Sorry, the surveillance, but the screening is actually something that has been developed to make sure that they ask the appropriate questions. And there's one that is very, it's used, in all the clinics that I've ever worked. It's called the ASQ. It's very popular, and it's a very big form that you fill out, and in the back it has the scores and then what you need to do next, right? So for example here, so a whole child screening tool like the ASQ3 evaluates communication, gross motor, fine motors, personal, social, and problem solving. And it can be done between the ages of 2 months to 5.5 years. So if your child is between 2 months old and 5.5, and you have a question, and you have a concern, and you believe that something is not right, but you don't know what is it that's not right, and you don't understand, sometimes you just have a hunch, and you just want somebody to either tell you, yes, your hunch is valid, or no, it's not. And then, but if you go to the doctor and you have a perfectly healthy, chubby, 4-month-old baby, the baby's healthy. There's nothing physically, I guess, wrong with the baby. So a lot of the times what happens when the baby's 12 months, I don't know, whatever age you want, they're like, oh, your baby's fine. It's okay. You're just reading too much, or we can wait. And then you're like, oh, sometimes you don't say anything because you're like, well, if something is wrong, then the doctor is really going to pick it up and let me know. So you just keep quiet, you don't say anything. The doctor sees your baby, maybe does the brief surveillance, which is just questions and a conversation. And then, okay, see you next time. And then you're like, oh, the doctor didn't say anything, so the baby's perfectly fine, right? So these are the things but the doctor can actually do a screening whenever you have any questions. So for 9 months, we're expecting a baby to have the early gestures of giving and reaching, right? Like if you say, oh, can I have it? They'll give it to you, or they reach to get something up. They can explore an object, looking around, up and down, bouncing the balls and all those things, right? They will notice you when you enter a room, and they'll turn to look at you. When you call their name, they will look, right? Because you're calling their name. And if they feel sad or frustrated or happy, and they have these meltdowns, they'll have one of those meltdowns wanting you to hug them, right? Looking for comfort. When the babies are around 18 months, they can look at you and use gestures and words together. And you can see a lot of these videos, like in Instagram and TikTok, when you see all these babies imitating what the parents do, and melting and routing for a team, or they're very cute. They can hang out with you, they can pay some attention what you're doing, and they want to interact with you, right? And they want to show you things. They bring you stuff for you to look. They are pointing, they are using their eyes to look at you, point at something, looking at you back to make sure that you're looking, and they are asking for a lot of praise and attention. And look at me, and look what I can do, and now I can jump, and now I can hop in one foot. All those things, babies do between 18 months, 24 months, and 30 months. Now around 30 months, they're supposed to be able to put 2 words together and have a vocabulary of over 50 words. And they can use, they can say phrases together, one indicating an action, like I'm running, baby running, like doggy run, or I eat, right? I eating, things like that. And they want to show you everything, and they want to make sure that you know about everything that is going on in their lives. And sometimes they aren't able to say the things, but they will make all these beautiful gestures and point and knock something, and somebody punched someone and somebody slipped, and they will let you know how they feel and what they want or need with a immature verbalization. So sometimes 30 months are fully verbal and they very you can understand everything they say, or sometimes with the gestures, and that's what we are expecting the 18, 24, and 30 months to be able to do. Now, when the babies are 18 and 24 months, that's when it's recommended to do the specific autism screening, right? They are administered at the same time they go for well child check. And with the 18 months that we do the whole baby screening and also specific autism screening. The one that is used the most is called MCHAT. And it can be used between 16 and 30 months. Basically, it gives you like indication if the baby pointing, is it looking at you, is he answering when you call their name, do they have do they get regular noises, and it basically is a checklist, and it's basically about baby social communication and how do they interact with the world around them, if they have any repetitive movements, any restrictions, any of the things like that. So those screenings, they exist and they can be done. The stat takes a little bit longer time, about 30 minutes, because you actually have to interact and play with the baby, and it's a longer format, but they are done at the birth to 3 programs here in Washington State. I have some referrals and they come with the stat and everything done. But in a regular general pediatrics office, between 16 to 30 months, if you have any concerns about specific autism, they can do the ASQ and they can do the MCHA. They should be able to do those things. Now, so what do we do? Let's say, what are the red flags for developmental delays, right? So if the baby is not, the motor ones, they're very easy to see and everybody sees them. If the baby not walking, the baby's not crawling, the baby's not pointing to stand, those are easy. Those are very easy to examine in the doctor's office, and then you get a referral for PT, or depending on what they find, ortho, genetics, neurology, whatever, and that one is done and easy. Cognitive is difficult to assess until the patient is about 7 years old. There are some assessments that can be done, but this needs to be done by a psychologist of the school district, or even birth to 3, they do cognitive. That would be if the baby is not speaking or not showing any interest in the world around them. When they get evaluated, they get a full cognitive assessment. For the language delay, also that one is a little bit easier because baby is a year old. Baby's not saying mama, dada, not even one word. Baby's 2 years, is not saying anything. So that one is, again, easier. When there is difficulty in social communication language, that's a little tricky. And then you would need like a different evaluation. But if the baby's not speaking, the baby's not moving the way they're supposed to be moving, the baby's not interacting with yourself and the world around them, if the baby has a lot of restrictions. When I say baby, it could be a 7-year-old. My baby's 7, so baby. They have a lot of restrictions. They're very interested in only a few things. They don't want to do what the other children's. They don't want to interact with the world, or they can't. Like they can't move, so they cannot be running around, or they're not speaking, so they cannot interact with the world, or they have no interest, and they don't want to. And not much you can do about it. But anyway, so for example, what if you take the baby, your child, to the doctor, and they do the developmental screening and it's positive? Well, they will give you a referral depending on what they find, either motor delay, language delay. Those are the big ones that we generally see, motors and language. And if we do specific screenings, that we do like social communication delays, but that is linked to language delay. And then you get referred. If it's birth to 3, you go to Holly Ridge and they do the whole assessment. If it's older than 3, you should go through the school district to have a whole child developmental screening done, right? But again, what if the screening is negative? Because either they didn't do a screening, they just did a surveillance. And if somebody asks you, how is your baby doing, and interacting. And they're doing the cutest thing. They're repeating what I say back to back. They are playing by themselves. They are just dancing and flapping around, and they are the cutest thing. They are very cute. But if you don't understand those are red flags for developmental concerns, then you're not going to say those things. You're going to say, oh, everything's fine. The baby's the cutest thing. He teases me all the time because he doesn't want to do anything I ask. He ignores me all the time. He's not answering when I call him, but you don't know that those things are signs of concern, but you think something is off, right? So what if you bring the concerns of the doctors, say, oh, we'll wait, the baby's healthy, we don't have to do anything until they're 3, whatever they say. So you have some options, right? So if you still have concerns and the screening is negative, or you were dismissed, or I don't know, you don't want to go to the doctor and you woke up today, so you know what, I need my child to be screened because I think something's off. So if the child is between the ages of 0 to 3, you can go through Holly Ridge Center, the phone number is over there, and they will do a whole child screening. And if they find any deficits, they will hook you up with a family care coordinator, and then they'll coordinate whatever care you need, right? If your child is older than 3 and you have concerns that they have any issues, you should go through your school district. And they should be able to at least do a screening and let you know, yes, he meets criteria for extra help, he does have delay, and then that's the numbers, the phone numbers for all the school districts in Kitsap, which we have 5 school districts. Anyway, if for the whole Washington state, for all children, you can go to the website for Strong Start or Help Me Grow, and then you can actually fill out the ASQ. And if there are any concerns, they will reach out to you and help you set up. I know it will help me grow. If you fill out the ASQ and the ASQ came back and it says that it's positive for probably developmental delay, they will help you set up with therapies or with anybody in your community to do either a more in-depth screening or an evaluation of whatever deficit they found. And that's it. So basically, if you still have concerns, you have options. But your doctor has been trained to do surveillance in every visit and screenings at specific ages and specific screenings about autism and many other things. They can screen. Even ADHD, they can screen. Anxiety, depression, they have been trained to do that.
Dr. Gomez. So I want to say that when you ask for a screening at the school, you ask for child find.
Oh, child find screening. Yes. Oh, that's true.
And then we have a question in the chat because we were talking about babies, but what happens when it gets missed until like they're 12?
So you do a child find assessment through the school system. I know when I say babies, my kids are babies and they'll be babies forever, but yes. Then you request a child find assessment through the school. And when you request it through the school, they could possibly tell you, oh, no, your child doesn't need it. You need it in writing. And they need to do the screening. So when you go to the school, bring a piece of paper, they sign here that today I requested a child find screening for my child, right? And then they have X amount of days to complete the screening and give you a report, a written report, why they decided to do the screening or why not, right? But they are supposed to do it. They're not supposed to just say, no, you don't need it. No.
So they have 35 days, and these are 35 school days to decide whether or not they will do an evaluation.
But the screening, they have to do the screening with those 35 days.
Yes, and then 25 days to do the evaluation.
But they have to do a screening, which is, they have to do a screening. But when the child is 12, okay, so it's Valerie. So the child is 12. What concerns about developmental delays do you think in a 12-year-old? Oh, you're muted, Valerie. Okay. You.
Hi.
Hi. So for 12-year-old.
So she's kind of immature. She's very impulsive. I have a whole list. I can't think of it.
Okay, no, that's fine. So for your child that is 12 with impulsive and your pediatrician should be able to screen for anxiety, depression, and ADHD.
Right.
And for a
She has
12-year-old, there are several
depression.
screening assessments. One of them is called CAST. I can write it here already. CAST, that you can do as well. And yeah, so if it's nothing about speech, is your child able to communicate?
Oh yeah.
So okay, so if they're able to form language, it's not a speech delay. If they're able to run, it's not necessarily a motor delay. So if it's a social communication developmental delay, then your doctor should be able to do anxiety, depression, and ADHD, and also CAST, which is like an autism screening. Again, screening, not a test.
Right.
And then the doctor should be able to determine, okay, either this person has this or that, or doesn't have it, or I don't know what else to do. And then you should be able to find someone else that can do the evaluation. But the school can do a child find for social communication, but I don't think they'll do it if the child is doing well academically. They might do the screening, but not, I don't know.
She has like B's and C's.
Yeah.
But
for social, I mean, they should be able to do a child find screening, but I don't know, because sometimes the school is the school. I don't know.
Does she have meltdowns at school?
yes, frequent.
Okay, so this, yeah, so the school.
That's good, because that will be, I mean, that will be, you will list that as the reasons why you want your child to be evaluated.
Yeah.
You will list the dates that you were called about the meltdowns, and as to prove that you should be, your daughter should be evaluated. You want to write down all of those dates.
Yeah,
I don't have all those dates.
Or not all the dates, but like if, and then if you have emails from the teachers or something, have that, just have those at the ready.
Do you get called to go pick up your daughter from school because of behavior issues?
Frequently.
Okay, so that should not happen. That should
Yeah.
not happen. And then they should do an evaluation, and they should do a behavioral treatment plan. You should not be picking up your kid from school.
Because that's a suspension.
Yeah. And then every time you picked up your child, they have to give you a letter telling you why you picked up your child and why they couldn't handle your child.
Right.
Because if the child misses more than, I think, 10 days of school, there's something. I don't know.
It wasn't for acting out. They haven't called me for
No, it
for the
doesn't
meltdown.
matter. It doesn't matter for whatever reason. Yeah.
Okay.
You should know. Yeah.
Yeah, it's usually, it's just more, it's hard to describe. And it's so erratic, there's like no pattern really to her behavior,
That you have found. You haven't found the pattern yet.
that I haven't found the pattern. I've been looking for 12 years trying to find the pattern, and it she seems to just kind of, she'll be fine, and then all of a sudden she'll be set off by something, and it's like a match on a powder keg,
Have you reached out to Kitsap Mental Health Services?
No, not yet.
But they only treat people on Medicaid. So if you have insurance, you would go to
Alexa, stop the time.
30-minute timer stopped on playroom.
Sorry. I don't know. My kids have a timer that is driving me crazy. I don't even know what. Yeah, so if you have Medicaid, Kitsap Mental Health Services.
I don't have Medicaid.
Okay, so I don't know, where would you go? Your doctor.
Child therapist. Yeah.
So do you know of a therapist that would do a screening, or?
No,
test?
the screening can be done by your doctor, and depending on what
Right.
the screening shows, then you
Right.
need a special referral, a specific referral,
Okay.
for either a deeper evaluation or for, I don't know.
Or like to get a diagnosis.
Yes,
So where would I go for that?
for the diagnosis.
Yeah.
Oh, but you have to do the screening first.
the
Ay, Dios
screening.
mío.
Right.
Isn't
Depends on
where the,
doctor says. It
yeah,
depends on what they find. So if they
Okay.
find that it's more anxiety or more depression or ADHD, maybe the doctor might be able to treat. If it's more towards autism, then
we can give you a list of resources of people that do diagnosis with autism in teenagers.
That would be awesome. Yeah. Thank you.
And isn't that on the next slide?
oh no, I think I said thank you. No, I think the next slide is done. Thank you.
Oh, okay. Well, I have
No,
a
I mean,
list.
because again, the resources, I'm like, it's just because a lot of people ask me like, okay, so I have questions and I think something's up with the doctor, and I'm like, oh, what is this? Like, don't wait for the doctor. You do you, because I don't know why they don't want to do any. I don't know. I don't want to speak for anybody else, but like they have to do the screenings and they
Right.
can do the evaluations, but I just don't understand very well. And I
Right,
want the
so I
parents
brought
to
up,
be like, and I want the parents to be, well, I know because I heard someone told me that you have screenings for me. And if we do a screening, sometimes we have like multiple behavioral screenings, and it gives you a possibility, but depends on the possibility of the diagnosis. And based on that, then you do a more detailed assessment. And if it's not within your scope of practice, then you refer out. But at least you know where are you going to refer them, or what are you going to do? And also there's like parent classes for disruptive behavior that they can take, or maybe they can hook your daughter up with, I don't know, social skills group. There's so many things that can be done, and I'm like, I want parents to know that they can ask for these things, but then I don't know how. I'm just
when I asked my doctor, because I was Googling the symptoms and they came up with lead poisoning. Well, lead poisoning symptoms, that's what the Google search results came up. So I brought that up with the doctor. The pediatrician at that time should have said, oh, you're having concerns about developmental delays. You should go to your 0 to 3 services. But they didn't. They said, wait. So that was not good advice.
also, and this is the thing, like, if you have to wait, you're going to be waiting, because they're not going to do an assessment on your child tomorrow. So you can be waiting on someone's wait list. And then let's say that you request, I don't know, speech evaluation or whatever. Today, you will be waiting several months to get evaluated. So if in those several months, your child starts speaking and starts communicating and blah, 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 then you can cancel that appointment, but you will be waiting anyway. So yeah, wait on a wait list. Don't wait without doing anything. So oh my goodness.
That's a good point. And also, so in my daughter's case, she has a very high IQ. She had very verbally fluent. Yes, she's used a lot of words. I taught her sign language at 4 months, so she had a large vocabulary, and could do puzzles really well. So that actually hid the autism. Plus, she's a girl. Autism in girls looks different.
It's very tricky.
But she didn't look when I came in the room. She didn't, if you make a loud noise, she didn't turn around with curiosity. She didn't respond to her name. She had very limited interests and never played with kids. I mean, I wouldn't say never, but she preferred to play on her own. And she wouldn't go seek kids out. she, if kids came into her area, she would be fine, but she didn't necessarily want to join other kids and do the same things the other kids are doing.
Yeah.
And
Yeah,
she
with the
toe
girls,
walked.
yeah. With the girls, it's tricky because a lot of the times they get very interested in things that are normally okay for girls. Like, I have one of my patients, she's obsessed with historical fashion to the point that if she watches a movie that is supposed to be, I don't know, based on the 30th, whatever, 1920s or 1930s, and they're wearing a dress, she can tell you that is wrong because whatever, in the 30s, that cut didn't exist, that pattern of flowers or whatever fabric, and she can tell you those things. And the mom is like, oh, but she started reading before she was 4. Now she's 17. And it took me a little bit of a lot to convince the mom that all of her anxiety and supposedly lack of focus was just autism, because she very anxious because she's always imitating everyone else, and she said that she can do 2 good outings a week, but it is expected so much of a high school student to be doing so many things. So she'll go home and she'll freak out, and then she'll have this panic attacks because she didn't want to go out because she felt that she needed to be just imitating everyone in order for her to fit in. And nobody wanted to talk about what she wanted to talk about. She was interrupted all the time. And she didn't like her friends very much because they will make all these inaccurate statements. I mean, it was so beautiful when I finally convinced these people. She doesn't need to be on any medication. She just needs to understand herself, and you need to give her space because she wants to be left alone. She doesn't want to hang out with people that doesn't want to talk about history. And she doesn't want to be hanging. She doesn't know anything about video games or whatever the kids talk about. She finds that extremely boring. So girls are very tricky.
I also want to say that I just recently got diagnosed last year in April of 2022 with autism. After my daughter was diagnosed and I was filling out the questionnaire, I was thinking, hey, this looks familiar. So if you're autistic and you think, well, I did all those things when I was a kid, that's normal. That's typical way of kid. So that was also another another tricky thing.
But if the child does not want to interact and learn and be curious about their environment and the people that surrounds their life, it needs to be looked at, because they're supposed to want to include you in everything they do. But what else? Anybody has any more questions? I want questions. Like, I want a lot of people asking me. I love answering questions.
I had that question, what does it look like in adolescence for you, Valerie? It's harder to diagnose when they become an adolescent, right?
Yeah.
Yes, because first they have gone through life being who they're not, and they have a lot of trauma and anxiety. They have learned to mask a lot of the behavior, and if they're not interested in the diagnosis, they will hide it, and they are so good at that. But that's why the diagnosis is either now or history off. Hi, how are you? You? The one behind Valerie? Yeah.
Oh. You have a good eye. I didn't see her.
Right there. I see kids everywhere.
That's my daughter.
So what do you do if the diagnosis or the screening comes back negative? Do you keep pursuing it, or?
Yeah. If you have concerns, yes. If the screen is negative and the doctor says it's in your mind, first of all, the doctor spends 15 minutes with your child, right?
But you know your child.
You know your kid, and you say, okay, the screening here is negative, but I still have concerns. Let me go to, I don't know, depending on the age, right? Child find or birth to 3. And if the screen is negative, you keep looking for answers, you keep documenting, you keep asking, requesting. Like, okay, so yeah, you could just keep a log of all the concerns that you have. And then the school, if the child's having trouble at school to the point that you have to be picking them up all the time, they should have a behavioral intervention plan. How they're going to manage the behavior, how they're going to make sure that the patient feels safe. They're not supposed to be calling you to be picking up your child all the time. So if they're having problems at school, then they need to do an evaluation. What is going on? Why is my child not wanting to interact, or I don't know, doing it wrong, or not doing anything at all? Is he understanding what is being explained? Does he have the ability to express that he's understanding? Or like what? Is he able to form memories? Like, why can he understand what is being said, or what doesn't he remember what happened yesterday? Like, they have to evaluate your child. So yes, you keep pressing until someone does something. Doesn't matter what age.
Yeah, I was thinking social anxiety plays a hand with autism. And if the child is not communicating because of the anxiety, then they won't be able to get help. But then, of course, that creates a meltdown at school, which that's probably what she's going through at 12. So I can't properly.
It's very difficult because they're middle school. And then in elementary school, they're very, I don't know, centered and everybody, the teachers and everybody. But when you go to middle school and you see all these people and it's so loud, I don't know. And then
changing classes,
it's very difficult. It's so much. And then people can be rude. And then one thing that I've learned also, for example, if you don't understand how to read social cues, it's so hard because people can be smiling and like completely offending you. And you're like, what? What are they my friend because they're smiling, or are they not because they're telling me, I don't know, go disappear? Like, what? So there's a lot of sarcasms, a lot of jokes, a lot of, I don't know. It's too much. Middle schoolers it's hard. That's why it's harder to diagnose middle school.
I agree, and my kiddo's not even there yet, but he did have an incident where he was told to wait. He was told to wait. The kid said he was going to play with him, and he was just like, wait right here, and he never came back. And so he just kind of stood there, and I'm like, no, let's go find something else to do, because this was it was an event at the school where parents and stuff came, and so I was like, well, let's just go find something else to do. But it was really hard to explain to him that the child's not coming back. It's like, you're going to stand here in this one spot waiting, and he's not coming back. It was so difficult, but he didn't understand this child didn't want to play with him. So instead of him saying he didn't want to play, they have taught them to basically just figure something else out. So he was just like, wait right here, and he just left him.
Yeah. And then a child that is neurodiverse does not understand, why did they say wait here and they didn't come? Like, what? That makes no sense, because
he was so upset with me because he was like, no, he told me to wait. And I'm like, no. We'd waste the whole afternoon waiting for him to come back. I'm like, he's literally over there playing with somebody else.
Yeah.
So Suzanne, we did we went through the slides, and I'll email them to you. I have your email address already. But do you have any questions for Dr. Violeta? Dr. Violeta now, her sole thing is to is diagnosing autism, and she's a center of excellence.
So my son, all sorts of red flags, kept asking the doctor, and we did a neuropsych evaluation, and she's like, yep, he has ADHD. I'm like, no. Like, anybody that met him would all tell us like, oh, he's autistic. And I'd just be like, yes. So finally he was 12 and got his diagnosis, but our life would have been so much easier had they been able to diagnose him earlier with all the anxiety and the sensory needs, and it was just a nightmare. So
Also, let me say this. Neuropsych evaluations do not diagnose autism.
okay, I didn't know that.
For everyone listening, everybody wants to have a neuropsych evaluation that is not diagnostic of autism, because a neuropsych evaluation basically tests your brain function. With autism, your brain function is not compromised. Your behavior is. So a psychologist can do a whole set of tests, spend 8 hours with your child doing tests and tests and tests. That's something that I've seen, and I get sometimes irritated. And there's not one observation of the child. Just test and test. You can test the memory. There's no problem with memory. You can test executive functioning. Maybe your child had problem with executive function. That's why he was diagnosed with ADHD, which a lot of kids with autism have. But that's not diagnosis of anything but the executive functioning of your child. So when they do all these neuropsych evaluations and all these tests, they do not diagnose autism. You need to observe a child, or you need to ask a detailed developmental interview and observe. Sometimes I have to go to the school, to the playground, to their homes. You have to pay attention to the kid. Just for everyone, I'm just letting you know, neuropsychs just test brain function, but not behavior. Mom, not that you did anything wrong, Suzanne. You did what what you had with the best knowledge that you had and what you had available to you. But yes.
Right. Now, I always thought that she believed you either have ADHD or autism, but not both. And then my other thought was he was also on 2 different medications for ADHD, which is why he probably did better, but we can't live without medication. Oh my goodness. It's pretty severe. So I just feel like maybe that's why they didn't understand. And, I'd be like, well, is he a diabetic? Because he's so sensitive? Like, what? There's got to be something else. And so it's just a nightmare.
Yeah. It happened. But thank you for sharing.
That's what we got, was a neuropsych.
For your daughter?
Mm-hmm.
Well, I bet he observed her. Did he observe her?
Mm-hmm.
Did an observation?
She drew a wonderful picture of him. He loved it so much. It was very funny. With hair growing out of his ears and
that exactly. So that's so socially inappropriate, but so beautiful, right? But again, but she was observed. But a lot of times I see psychologists that they do a whole lot of assessments, and then the assessments came back and his brain function is fine. Yeah, I'm not expecting the brain function to be abnormal, but behaviorally, there's no one description of behavior. And that drives me crazy. Because then again, the diagnosis is delayed because
she also called him fat, and she jumped up and down on the couches. So
yeah. So also people think that for the appropriateness of socialization, people think, the child that has autism is just on its own and not doing anything. A lot of the times they are so socially inappropriate, they don't understand body boundaries, so they will be just going to anyone so close to their face, talking and chewing, and can have some of that, and they will go with anyone and have absolutely no fear of anyone. So that is also inappropriate. Or they'll make so much inappropriate statement like, "Oh my God, you're so fat." Oh, what do you think they say? Yeah, like
she goes up to any strange man at the park, and starts talking it up. It's like, no, honey.
Yeah. That's not always want to be alone.
Not a safe stranger.
By people, and also that happens with the girls. You would see a bunch of girls together, but you see that child with the girls but playing on her own, like parallel play. They'll be around other kids, and the group moves, and that child also moves with the group because they want to be social. They want to be surrounded by people. They don't want to be alone. So they just go and they just do their own thing. Nobody wants to be alone. They don't have lack of empathy either. They have empathy with people having the same brain type as them. Because you break your arm and you're, oh my God, it hurts. They're like, yeah, go to the doctor. Like, I'm not gonna do anything. But you lose this tiny little piece of paper that meant the world to you. They'll try to find it for you forever, because that piece of paper, they know how much, and also they really love objects, so they know how much this piece of paper means to you. But your arm, go to the doctor, like, what is this? So yeah, they don't understand you, but they understand objects and things that you like.
Does anyone else have any questions? Autism is one of my special interests, so
Mine
I've
too.
done a lot. So
So what do we do in the meantime while we're waiting for all these screening, et cetera, stuff?
ooh,
You go to your doctor. But I mean, that's the thing, because even if the anxiety is related to anything else, maybe medication for anxiety will help. Maybe if it's, yeah, because ADHD will not present like this,
hold
but
on.
anxiety medication will help. So your doctor can help you there. And then, I don't know, but yeah, oh, here it is.
So I created a slide in the meanwhile.
Yeah.
This is like based on baby stuff.
Yeah,
but there's these links, what to do while you wait, and what can I do for my child. So a lot of them are centered on younger children, the links, but you could watch the videos that are posted to our YouTube channel about autism, like all behavior is communication.
Also, sorry, you can try to find parental training for disruptive behavior for you, and you can ask your insurance company for behavioral health. So you can find a therapist that will do also the screening and everything that your doctor will do in the meantime. Because
local or in Seattle?
No, whatever you find easier, the fastest for you.
Because if we could find something local, that would be amazing.
Yeah, local to Kitsap, yeah, there's for therapists. Let me see. And ask the school if they can do an evaluation if she's having hard time at school. And yeah. So therapist, school.
Also, I would like to say you could join some of the self-help groups for autism and, other disorders, or what, I don't know what you call it. But some of the things that I've learned for my kiddo, I've actually learned basically through other parents, because he's not there yet, but their kid is. So it's just like, oh, okay, so, this could be what's going on once he gets to this level, or, once he gets to that age. So you can just observe and listen to, other people who are going through similar things. If you want to join, one of the groups, like I'm a part of a couple of them on Facebook. One of the kids, here's a good example. One of the kids was saying that he didn't understand humor. Like if you're watching a movie and you see something that's funny and you start laughing, my kid will go, stop laughing, and I'm like, no. And then you have to literally physically explain why this is funny, because they don't get it.
Mm-hmm.
So, I mean, I that didn't compute until I read someone else saying that this is something that they had to do for their kid. And so then I started doing it for him, and he totally got it. He was like, "That's so cool." He's like, "Oh, wait, explain to me, why is this funny?" But I mean, it wasn't until I prompted him that he figured he could ask. Before, he was just like, "Just stop laughing. It's not funny." And I'm like, "No, it is." So I don't know. That's just something I picked up from another group.
Yeah, the Facebook autism support, Kitsap autism support group is pretty active, and there's always people talking on there. And then there's AANE, which has support groups and information. AANE is Asperger's and Autism Network, something, AANE. I'm going to put the link in. Oh, I have to stop sharing to go back to the chat. Oh. And then I'll send out a list of people that diagnose people in Kitsap County if they pass the screening.
Thank you.
I also get a lot of support from Reddit on autism, r/.
Reddit? Like Reddit?
Reddit.
Like
Yeah.
REDDIT? Reddit?
Uh-huh.
Oh
Yeah. People are posting questions and things all the time. A lot about spoons. Autistic people like spoons a lot.
Oh my God. I don't know what it is. Okay. I don't know what is it, but I have someone that said the spoon theory. I didn't know what it was. Anyways, I have a patient. He's 4. He walks around with a wooden spoon under his arm, and his mom was driving like crazy. No, this is not like she didn't like that. I don't know why, since it was a baby.
I just let him have it.
But she didn't want to. So you know what his grandma does? Every time she goes, she brings him like a bunch of wooden spoon from the dollar store. So he has an endless supply of wooden spoons. And the mom didn't want it. Eventually, I'm like, you know what is wrong with the wooden spoon? Just leave him alone.
Yeah.
And he loves this wooden spoon. He walks around with this, like a little man with his wooden spoon. It's the cutest thing I've ever seen. You see, those things are so cute. So if you don't think, though, this is excessive, or I don't know, you wouldn't even bring it up because it's so cute. Like, what? For the mom, like, that's cute, but this is weird, right? So, and there's other things going on. And then she was asked to wait. And then at 3.5, she's like, oh my God, I cannot wait any longer. But it was the cutest thing with a little thing. Oh my God. So
one of our kids at the ABA therapy, he loves spiders, aranya. So when we did we always changed out our decorations, but we kept the aranya, the spider, in the window. We just moved it further down so that he could see it. So we had a Christmas spider, we had Valentine's spider, we had Easter spider.
that's so cute.
Clever.
So cute.
My kid was into sharks. We have every shark book.
Nice.
Gabe's obsessed with trains.
Oh my God, my son. I know so much about trains.
Trains. Oh my God.
The coal car, the hopper car.
No, but it's because they're aligned, right? And they line up. And then when you said the trucks, you're lining up the track. So it's not abnormal. But if they only want to do train and every time they play, they line things up like train, then that's a red flag. But yes, trains are the best.
Cars are secondary, but trains are number 1.
I have a patient when he was 2. Now he is, I don't know, in high school, whatever. But the mom found a bunch of notebooks. She said that was one of the restrictive things, that she would have to buy him notebooks every 2 to 3 days, because all he would do was draw train tracks when he was 2. So you open a notebook and you flip it and it's all train tracks. And the mom tried to draw something else because he'd be like, come. That's what I think, like, come join me. So he wanted to share with her, but only his interest. He was not interested in anything else that she wanted to do. But it was like, come sit, let's draw. And she's like, oh, sure. So she's trying to draw a flower. No. A train track. And the whole, every 2-3 days, she will go to the dollar store, buy notebooks. So she has a box of notebooks. And that will be so scary. Just train track. So that another one that was delayed because he was social, but he wasn't really. He speaks very well.
Yeah, my daughter is very social. I mean, she's an extrovert, so she's always trying to like talk to people and make friends. But like you were saying about the social inappropriate,
yeah,
like she'll just say whatever comes to her mind.
Yeah.
Whether you should or not. And,
yeah.
And like her personal space, she's very close to people. She doesn't understand boundaries, or
Does
she
she
understands.
understand, like, okay, so when she's saying something inappropriate and you make a face, does she understand or changes her behavior because she understands your face means that's inappropriate?
I don't know if she understands it or not, but it doesn't change anything. And even
she
when I
doesn't
tell
know.
her, okay, you don't say stuff like that. Well, why? Because it's not
Yep.
appropriate.
Okay, yeah, so
And then
that's
there's
the
always some
social
excuse and-
inappropriateness. And that's what and this girls,
Yeah.
again, she's social, but she's really not, because she's just
talking about what she
She's
wants
not-
to talk about.
yeah, and she's not
Right.
working
Constantly.
understanding social cues. So she doesn't understand social cues, and she doesn't follow social norms. It's just whatever she wants,
Right.
whenever she wants. Girls, they're very tricky, girl. So tricky.
Yeah, I remember my mom asking me, or at least making a comment. She's like, "Oh, she's kind of narcissistic, isn't she?"
Autistic children are, but
Right.
it's not because they're narcissistic. They like objects, and they don't understand anyone else. They cannot put themselves in your shoes.
Right.
So
Yeah.
It's called mind blindness.
yeah, it's just that's what autism. Auto is like self. So that's they're just into themselves. And it's not like they want to be, they just don't understand how to be different, because why would they
Right.
understand?
I'll put the YouTube channel in there with there's a good one called Autism 101 that Monica Meyer put, and that's more about what it looks like in adults too.
Oh, that's really.
And the other common thing is that, so this is, my sister pointed this out, is that a lot of autistic kids walk on their toes. And she was pointing at my daughter. Oh, I've got kids that walk on their toes in my kindergarten that get diagnosed with autism.
That's been true so far with my kiddo. He's getting put back in braces.
Oh, because he won't walk with flat feet.
Yep.
That's the vestibular system at work. Yeah. And they can probably sit down. They have to cross their legs when they're sitting down anywhere. Yeah.
Well, they do the
upside down and spinning. And
they do the
themselves
W
and rolling.
sitting.
Yeah. Yes, the W's. Yeah. Mm-hmm.
Yeah. My daughter does the W sitting because she doesn't have the core strength.
Mm-hmm.
She loves the trampoline.
Yes.
And then he's
Proprioception.
hyper extended, or I don't know.
Yes, my daughter's hyperextended. She's got Ehlers-Danlos, so hypermobility.
Yeah, the therapist like bent his thumb the other way, and I was like, "Oh my god!" She looked like she just broke it.
Mm-hmm.
She was
My
like, "Have you
daughter's
noticed
toes
it?"
can go like all the way. Yeah, she can bend like her we actually took her to physical therapy to work on strengthening her hips, because her hips, you know, she could put her leg all the way up like this.
Oh my God.
Yeah. So ask your daughter if she can touch her thumb to this. Oh, we got a new person coming. I don't know.
Well, he was trying to explain, well, you know, because he has, you know, that flexibility, it makes it hard to write.
Yes,
Mhm.
that is
And opening jars or things,
Yep.
she's always having a hard time
very
opening things.
clumsy. Yeah. Mhm.
Hi, Sunita. Welcome. I don't have your email address. If you want to share that, you can just private share it to me, and I can email you the presentation and the link to the recording. Let's see. Thank you. And we're just doing question and answering. So do you have any questions today? We've already asked all of ours. Now we're just sharing stories.
Oh, sorry for joining late. I had to put my kids to sleep. Sorry.
Yeah, that's all right.
Okay.
Thank you for coming when you could.
Yeah, of course.
Yeah, so do you have a question?
I don't have any specific questions. I guess then I'll just look for the link for the recording.
Okay.
Malia, are
you.
you going to send that out to everybody, or do you want us to put our email in the chat?
Yeah, could you put the email in the chat so I can get that to you?
And then am I able to share that with parents at our preschool?
It'll be posted on YouTube. So yeah,
Okay.
it'll be a live.
Thank you.
It'll be there for everyone.
Thank you.
I think I have your email, but I can't remember what it is. So we could, if no one has any questions, I suppose we could end this early. Let's see. Sorry, I got distracted. I have a lot of information on my webpage, at Kitsap County Parent Coalition resources, under autism too. And let's see. Deliver.
Is there any information on there about late diagnosis? Like if your child is, you know, maybe even older than 12?
Let's see. Then just click on the autism. I have about how to get a diagnosis. That's not on the not specifically. So I have a list of people that I could send. So I will send the list
Could you
of
send that to me?
yeah.
Sorry, I was just curious. It seems to be a very trying thing just to get, you know, 3 to 6 or, you know, 6 to 12-year-olds diagnosed. I was just curious to what's the struggle like being diagnosed late? Or
The problem, I think it is that
Your parents
is-
have to be alive.
well, that's one thing, but no, also, for example, even for teenagers, it is easier as a clinician to get an accurate developmental assessment from a child that is younger than 6. And also because they haven't lived that long and they haven't learned to mask a lot of the behavior, the observation is purer. Like when I see a 3, 4, 5, 6-year-old, I mean, I don't even need to do like a very big 2 hours formal assessment. I can just point or call the name or do what I need to code that assessment and play. I can just sit down and play with them and see how they just go and put all the balls in one corner, all the squares in another corner, line up the cars, don't talk to me, make random noises, how they request for food. Like I'm able to see the behavior and I'm able to see everything I need for diagnosis in a span of an hour because it's so pure. They haven't learned how to mask. They haven't imitated anyone else. Now, when the child goes to school, they learn to imitate. They learn the proper behaviors that is acceptable. So it is more difficult to get an accurate diagnosis from a parent because also the parent has been struggling and he has trauma from dealing with someone that it has been very difficult, right? If the child has been difficult, maybe the child has been difficult. But if you have been struggling with your child, you have trauma. I mean, so everything you're going to tell me is everything is wrong. Nothing is good about my child. So you're going to give me all this history that is completely negative about your child. Maybe not, but that's what I find. Like when they are older, everything is bad. They never talk. They never walk. I don't know how they're here. Like they never do it. Like and then the interview part, not even the assessment of the child. Sometimes it's taking me over 3 hours because it's like going back and forth. Like look at videos from when they were 1. Look at pictures. Not everything was bad because also we try to make sure that we can report their strengths because that's the only way you can teach anybody anything if you teach them the way they want to learn. And if you help them master what they know, they'll have a better and joyful life than if you try to teach them something that they don't care anything about, right? So if you tell me that everything was bad, so that's the thing about older than 6, it gets a little muddier, and it's because the parents have either a very negative experience in parenthood and everything is bad, or they don't remember a lot of stuff because of the trauma of raising this child, and the child has learned behaviors, then it takes a lot longer. And a lot of the times we don't have the time to sit down and then do an evaluation for, I saw a 3-year-old that has learned to mask, and it took me 2 hours to do an evaluation that should have taken me 30 minutes. I had the time because that day that was the only patient. But I mean, it takes a long time. And then you have to try to understand it. And then also they have trauma because they have to be who they're not every day. And they have anxiety and they have depression and then they have family conflict. So that's why is a lot of providers do not want to evaluate older children because it's very time consuming. And a lot of the times, if they do not have an IP, then you also have to do an IQ assessment, a brief one. Like we're not gonna like the full scale that the school does, at least I'm not certified to do it. Or the providers were not. Psychologists and school psychologists are certified to do it, but we have to do like a brief IQ assessment, adaptive assessment. So it takes way longer. And sometimes you go through the whole thing and you still don't have a diagnosis because you don't see the behavior, because the history is like either the child has every mental health possible that you can think of and you cannot pinpoint to one thing. Because if you treat, I don't know, anxiety with ADHD.
But what if the child is actually still having physical issues
then it's
like,
easier.
like what I mean, what are you supposed to do if the child was never diagnosed and, you know, they're like almost 20 and they're still having, you know, like issues where you don't feel like they can actually function if you weren't around?
Okay, so they need, okay, this child has an IP? Did they have an IP through the school?
In school, yes.
Okay, what are they doing now?
Nothing, just living at home.
Okay.
But the evaluation was rejected for, you know, autism, ADHD, you know, different things. So that's the reason why I'm asking. I'm like, okay, so the child is older than 12. What are you supposed to do? Because she, you know, she can't bathe on her own. She has to still be told, you know, to do these things. Obviously you've gone through puberty at this point, so you know those things need to be taken care of. But the child, the evaluation was rejected. So I'm just curious to, if the evaluation was negative, what do you do after that?
Okay, so there has to have a diagnosis. If this person is almost 20 and he cannot even bathe themselves, then there's two things that they need to be done: IQ and adaptive assessment. If both are low, then this person has intellectual disability disorder. And if you are intellectually disabled, you're gonna be delayed in social communication as well. So if this person has intellectual disability disorder that can be proven by assessment, like neuropsych assessment will prove that, or yeah, probably that, yeah.
I think she was diagnosed with opposition defiant disorder, but that was all.
And that's a diagnosis that is given a lot of the time to people that have autism because they don't know how to say, no, I don't want to do that in a way that is socially acceptable. They will just freak out, right?
Yep.
They'll kick and scream and do all these things because that's the only way they have learned to do it. So then that person needs an IQ assessment and adaptive assessment. And if both of them are low, then this person can apply for DDA and SSI to have some help. And at that age, I don't know if there's any occupational behavioral therapy that person can take. I don't know that. Maybe there is, I don't know.
Okay.
Yeah.
Okay.
Yeah.
Where
And
do you get an
intellectual
adaptive
disability
assessment? Do you have to go to
psychologists can do
psychologists?
It's ABA or Violent assessment. And then IQ assessment. If both of them are low, then yes.
Services, it's just that she doesn't have a diagnosis. I mean, she qualifies for like I think it's called ABLE. They assist her with employment and things and stuff like that, you know, but other than that, she's not receiving any type of services.
But if that person needs to have a diagnosis, who can be almost 20 and not being able to do the things that she's supposed to do to survive out of the world. So no, I don't know. I'm angry now. Like, I don't know what to tell you because that's unacceptable. A diagnosis has to be made. And according to DDA, based on the age, they have, I had it in my phone the other day. Let me see.
26.
Well, yeah, and then when I asked, you know, her about who did her first diagnosis, it was a pediatrician. And so I'm just like, okay, well, how do you go? I mean, do you even go that far back? I mean, it was a pediatrician.
Yeah, you have to go as back as you can, even whatever, it doesn't matter. But this person needs, she's 20, 19?
Yeah. Okay. She's 20.
Does he have Medicaid?
Yes.
Kitsap mental health services, please. Have you tried that?
No.
Call Kitsap. You can just appear and be like, I'm here for an intake access assessment, whatever.
Yeah,
and
go to access.
You go to access and you be like, I'm here. You need to figure me out. And they do adaptive assessment. It's called ABAS 3. I know they do it.
Okay.
And the IQ, I believe they have a psychologist. If not, if they figured it out. But no, no. I'm angry. I get so angry. No. Oh my God. I don't want to talk about it. I'm getting
her mother just gave up. She's just like, I guess she'll just live with me forever.
No. The point of doing all this stuff when the kids are young is so we can create functional adults. Because
she was severely taught to mask. Severely.
No. And it doesn't matter the label that you have, right? You need help. So it needs to be within those qualifying diagnoses so that person can access services. So that person goes to Kitsap Mental Health and be like, here, I need help. I don't know how else to get it. And they will do whatever screening they do, and they will figure something out. So. Oh my God.
Thank you so much. Because yeah, she just figured that there's really nothing else that she can do. Like, you know, she's basically an adult at this point. So it's
That's
just,
not
and I'm
true.
just like, well, technically her age is she's an adult. Or you know, she will be, but at 21, but intellectually she's not. I mean, she's not doing
Okay.
these things that she
Oh my
should be
God.
doing on her own. So it's just kind of like, okay, can there be anything done at this point?
If that
Is
person
she,
has an IEP, the people at school, they did a full-scale IQ and an adaptive assessment. If both of those things are low, then that person qualifies for intellectual disability disorder diagnosis, which is a cousin of autism. ADHD, autism, intellectual disability disorder, dyslexia, social pragmatic communication delay, all those are cousins. They're part of the same thing. So if, okay, I get so angry. So an IEP, a doctor can diagnose ADD, they just need to review. Oh, IQ less than 70. Oh, adaptive less than 64. Yes, intellectual disability disorder. That's all they have to do. Oh, I get very angry.
It's
it's
been real.
a really good tip for people with Apple Health to go to KMH.
Mhm.
And I suppose if you don't have Medicaid, then you go to your insurance and ask.
Yep.
For the list of providers. Or pay out of pocket and send a super bill.
But yeah, but pay out of pocket where? Because Kitsap Mental Health will take you if you don't have insurance.
No, Kitsap Mental Health will not take you. You
Exactly.
have to
So-
have Medicaid and they will not take anyone else. Yeah.
Exactly. So I mean, that's the thing. Like, where do you go? How do you find? Because what I like about Kitsap Mental Health Services is that they do therapies and they do the diagnosis and medical management if you need to, and they have a team for you that works with the parent, with the child, with the school. So how can that be made available for everyone? I mean, I love it.
We just have to do shopping like onesies to, you find your mental health provider here, your psychiatrist there,
But who's with you? Who's with you going to the IEP meetings for the school? Like, parents need representation. They don't have it. They don't know what they're doing. And the school doesn't educate them on the things I get very angry. Valerie, call your insurance company, tell them you need a case manager. Maybe they have one of those.
Case manager.
Yeah, to help you find resources because you need help. Again.
And have you got an IEP yet, Valerie?
Not for my daughter.
Oh, right. Okay.
My son had speech delay. He went to Holly Ridge. So he had an IEP, I think.
An IFSP.
Something like that, yeah. But then he aged out. So and then he turned 5 in October, so we put him in private school and he's in kindergarten because he was reading. But there's sometimes when it's like just little things, not as severe as my daughter, but there are little things where it's like, that kind of reminds us of
It runs in family.
It does. And I mean, my brother was never diagnosed, but after doing all this research and going through this process, I think that my brother and possibly my dad too. So it's like, grr.
Yeah.
Can I tell you, when people tell me like, oh, autism is only now, it never existed before. And I'm like, no, it's always been here. Why do you think we have electricity? Who crazy person can only dedicate their life to creating energy out of nothing? Like, who is going to be so invested in making sure that we have water in a pipe coming to my house. It was not someone that neurotypical. I'm not neurotypical. I'm very ADHD, by the way. And I'm like, no, like it had to be someone with only one interest in mind. Because, you cannot do that in a lifetime, but they did it. Who can invent an electric car? What? Yeah, we've had them forever. And then I asked the question and they're like, wait a second, is that abnormal? Huh? And then they keep thinking, and then the dad, and then the mom's grandma, and then you can go back generations, and there was someone a little bit off. Well, yeah, back in the days, I'm reading this book called Neurotribe. In the psychiatric hospitals where the kids were hospitalized, 1 in 7 had schizophrenia as children, which is not a diagnosis anymore. So probably they had autism, and it's 1 in 7, just like in now. It's weird.
Crazy.
Sorry, I just get very excited.
My grandfather was an electrical engineer that wore the same clothes every day.
Yeah.
And they had like the same thing on Tuesday to eat and the same thing on Wednesday to eat.
Right.
It's fantastic. It's so interesting when I hear the story. That's why I love this word, because I'm very gossipy and I love asking questions, and I take forever because I love it. So
He watched that Temple Grandin documentary with Claire Danes. That
the movie? Yeah.
Yeah. And he's like, that's what I have. I have that hamburger disease.
Oh, my daughter calls it
Asperger's.
enthusiasm, a hamburger disease. My daughter calls it enthusiasm. She's like, Mom, do you think I have enthusiasm? And I'm like, sure. I don't know what that means. What will you do? And I'm like, autism? Yeah, that enthusiasm. And I'm like, yeah, I have something else, but not this one. So interesting. But yeah,
That's funny.
enthusiasm. Yeah. So yeah, we all have it. We all have that little thing. And then everybody was undiagnosed, married to everybody that was undiagnosed, and now, and we're looking for it. Now people are more educated.
Yeah. I have a nephew too. I have I have one that's diagnosed and one that's undiagnosed. The
Right.
undiagnosed is 27. But that's because they had the DSM-4 back then. It was different.
Yeah. You have to have speech delay. We know now that you don't.
Mm-hmm.
And speak a lot. But yeah.
Oh yeah, my daughter definitely did not have speech delay. Talkative from day, like, yeah, the whole thing. Yeah. Like I said, she's an extrovert. You saw her. She came in. Yeah. She's great. She's just, she struggles, and it's hard sometimes to
hard
help
part.
her understand.
Yeah. Because they are cute. They are the cutest thing, but they struggle.
Okay.
So just to recap, you said get the screening from the school district or the doctor. And then after that.
Both. Because even if you get the screening from the school, it's not a medical diagnosis. Okay. So even if the school does the assessment, you still need a medical diagnosis.
Right.
So
but the screening you said is not the diagnosis.
No, but it's going to guide you through what path you need to take to get an evaluation done. Yeah.
Right. By a psychologist.
Or a COE.
You both. Yeah.
Yeah.
Okay.
And what the school will come up with, it will probably, it might be learning disability. They can't do a medical diagnosis. They just say learning disability. They won't even say dyslexia or dysgraphia or whatever. They just, that's it, learning disability.
But the good thing with the assessments that they do, then it's easier once you read an IEP to determine what specific delay or criteria the child meets within the spectrum criteria, diagnosis criteria. So those, preferably they need to get done because we need some information. But yeah, they won't give you a medical diagnosis that the insurance will take and be like done. Do you have TRICARE?
No, unfortunately.
Okay. No, that's fine. That's okay.
It's
No, just asking.
good.
Yeah.
It's good. Um,
So screening, doctor, school, and Mary is gonna send you the list of things.
the COEs, yeah.
So the school will do the screening and then they'll send it to the doctor and then the
No.
doctor will do another screening.
No, the doctor is gonna do a screening and it's gonna determine what is the possible explanation for your daughter's behavior.
Right.
And depending on what the possible explanation is, there could be different referrals that can be made.
Okay.
And whatever referral they made, then it's gonna provide you with a diagnosis and treatment plan. The school is gonna do, hopefully, a child find evaluation. And if your child is eligible to receive special education instructions, then they're gonna create a plan for your daughter in the way that helps her learn what she needs to learn. In that
Right.
process, they are supposed to determine adaptive assessments, adaptive skills and IQ, and behavior and academics. Not only academics, writing, reading, and math, plus a bunch of other stuff that makes up a person. And that makes up, like, I don't know, the educational component of for example, the neuropsych assessments are the same thing that the school does. So basically the school, if they decide to do the evaluation, they'll do a neuropsych assessment, a neuropsych assessment on your daughter.
So who do I
Psychoeducational.
contact at the school to do that? Would that be the counselor or the front office?
You can do anyone. You can ask them, well, I need my daughter to be screened for a child find. And they cannot tell you no. You
Okay.
only leave if they give you a phone number and they tell you where to call. If they say, no, she doesn't need it. Thank you for your opinion. I need the number for child find. They'll give you the number and you're gonna call them and seriously, bring a piece of paper and they need to sign. Valerie came this day requesting this and they have to sign it. That way you can count the days. Don't leave without a formal no in a piece of paper that says no because of this. Okay?
Yeah.
Or yes because of whatever. But don't take like no or yes out of the mouth of people. No.
Right.
And
Washington PAVE has a really
yeah.
good toolkit for requesting an evaluation. And it's called, Where to Begin When a Student Needs More Help. And here it is. And there's a sample letter.
Oh, wow.
You
that
don't
you
have
can-
to bring a letter. You don't.
Can you email that to me? That's
great.
really long.
Oh,
Put it in the link. It's in that one. It's in a link.
yeah. Yeah, I could put it, I'll put that in the email too.
Washington PAVE.
Mm-hmm.
Yeah.
Child find.
There's a link in there.
Yeah, you can right click on the chat and save to your computer.
Yeah.
Okay. If I can figure out. how
And
to do it.
I will also send this out in the
That's one of
email.
my missions. Make sure that people understand they can request it and they cannot leave without, no, that's okay. No. Oh, I get angry. I've been
Well,
very angry lately, just so you know.
they don't fund
And how-
special education. That's
I
why.
know,
They
but they should do the assessment and then if they do
It's
it, they
illegal.
find that they don't, it's illegal to do the assessment?
No, it's illegal to deny parents because they're infringing on the ADA.
Yeah, Disability Act. But that's the problem, that they don't
But-
do it. But if they do it and they say, we have 100 patients and only 3 therapists, we need more funding, they'll get more funding, hopefully. But they don't
Well,
do it.
There was a legislation that failed. There's a cap that they put.
On Easter, when I got jelly beans, where did you put the jelly beans?
I don't know. Say hi to everybody.
Hello.
Hi.
Hi, beautiful girl.
This is Oakley.
Hi.
Can you wave?
She's like, no. Why? I don't know these people. Like, what?
So I'm in a meeting right now and I will answer your question about jelly beans because I don't know it right now.
How don't you know what the jelly beans are?
I don't know. It's a pie. I don't know. What was I saying?
That it's illegal for them to reject an assessment.
Oh, wait, there was no, I said the legislation
Yeah.
that
It failed.
so there's an actual, they put a cap on the amount of money that they give schools for special ed services. And so local schools are going way beyond the amount that they are given.
What are we
So
supposed to do then?
yeah, so then so there was legislation to remove the cap and they didn't remove it. They just raised it to 15%. 15% of what? I don't know. But instead of 12.5%. So that's why it's hard and you get a lot of pushback at schools to get your special ed services. It's because the local schools are raising levies, you know, for special school projects, and then there's having to spend those special monies on special the levy money on special ed instead of the actual projects because we're not fully funded.
That's frustrating.
I get more angry now.
And they also spend about a third of their budget on lawyers to fight the students. So a third of the school's budgets are on lawyers.
Well, that's ridiculous.
But I don't have data to back that up. So I have to do some more research on that.
When you go to ask for services too, because then you feel like you're like fighting the people who are supposed to be supporting your child.
That's
Right.
the most frustrating thing.
Because it's like I'm like I don't want to argue with these people, and then I leave him in their care, and now they're mad at me because I've asked for something that they can't provide or something that they feel like they can't afford.
Mm-hmm. You don't want them to retaliate.
No, but
And
if they can't afford it and they need to provide it, then they have to find it legally.
It's illegal to deny services by the ADA, which was passed in 1990.
They have to find the resources or find someone who can do it. They cannot say no. That's the same thing that you should not go picking up your kid because of behavioral problems every time there's a meltdown. They have to have a behavioral plan in place. If that happens, what are they going to do? How are they going to keep your kids safe? Because you're leaving your children at school, they're supposed to be there safe, and they're supposed to know what they're doing. If they can't provide a behavioral treatment plan, then they need to provide someone that can be with your child all the time to help them calm down. But I don't know what they do because I'm not in school. I just get angry.
But we can turn that anger to the next legislative session that starts in January. It just ended on the 23rd. So the budget has been voted on and passed. So we can turn that anger into action.
I turn it into nap.
Into a nap?
Oh, I nap a lot. When I'm angry, because I don't know what to do, I just nap.
Well,
so when you said child find, is that FIND or FINE?
Find, FIND, child find. That's the law. Yeah.
Okay. Sorry to interrupt. Just making sure.
They're mandated. That's why it's called. They're mandated to seek out children that need services. It's not just parents that refer. Anyone can refer a child, and they're supposed to be watching for
Yeah.
children that need it.
I'm
That,
gonna send the link from the website, from the opposite thing in Washington State.
mhm.
And there in the website, you can find a lot of information that you need.
And
Thank you so much. This has been really helpful.
come to our IEP clinic in June if you can. It's at
Then
11.
I'm gonna go just so I can know more, because I just
What
fight
day?
all the time.
What day is it?
Let's see. That was, I had it up. June 7th, 11 to 1. And if you can't make it to that, let me know, because the person that provides that training doesn't want to do them online, which makes me sad.
Do you know what day of the week that is?
It's like
Is it?
a Wednesday or something. Or
Oh,
Thursday, I don't know. Let me go to the,
if it's Wednesday, I can't make it that day. I work on Monday, Wednesday.
Wednesday.
Fine. That figures.
But PAVE has lots of trainings and that you can attend online and that are already recorded.
Okay. I'll look at those.
Mhm.
Thank you so much.
You're welcome.
That's just my daughter in the background having another meltdown about why we're on the computer so long.
Oh, so you need to go. Well, I think we've gone past the time. So thank you for showing up, and I'll send that email tomorrow with the link to this recording and the presentation, links to PAVE, and hopefully we'll get our kids the help they need.
Thank you.
Yeah, thank you. And I'll be the last. I'm not going to close this until everyone leaves. So if you want to stay and ask questions, I'll stay as long as you need.
All right. Bye. Thank you.
Goodbye.
Listen, Kim, I didn't want to make this like a business thing.